Hello, my name is Kimberly Norman. I'm discussing today something that I'm sure that we all have at some point in our lives um, knew someone with a type of respiratory disease. Most of us know someone that struggles to catch their breath or may even reach in their bag or in their pocket to get an inhaler. Asthma is a condition that is often overlooked until someone experiences a severe attack. I chose this topic because I've seen firsthand how asthma can impact someone's quality of life. Based on my research, I will explain what asthma is and how it affects individuals and the treatment options that are available. Asthma is a chronic condition that affects the airways in the lungs. If it's left untreated, it could lead to other health issues and it could be fatal. I will talk about my topic in 3 points. Number one, the primary cause of the triggers of asthma. Second, the effects of asthma on daily life and health. And third, the available treatment options and strategies for managing asthma. The exact cause of asthma isn't completely clear, and it can differ from person to person. It's probably a mix of environmental and genetic factors. Asthma is caused by inflammation and narrowing of the airways, but several triggers can worsen the condition. According to an article, the Centers of Disease Control and Prevention, 2023 article, common triggers include allergens like pollen, dust mites, pet dander, as well as irritants such as smoke and strong odors. This article further mentioned environmental factors play a huge role as asthma triggers, particularly in older and poorly maintained buildings. Living in New York City, this definitely seems like it's hard to avoid. Urban asthma is a growing health concern, especially in underserved communities. According to Kerbin, Osley, and Porter, urban asthma is frequently described as one of America's fastest growing epidemics. The epidemic particularly acute among the poor, African American, Latin children living in urban neighborhoods. Asthma can also have genetic links with a family history of either asthma or allergies will make the increased likelihood of developing this condition. It will increase the likelihood of developing this condition, Asthma doesn't just affect the lungs, it affects and impacts people's daily life in significant ways. Asthma affects individuals in ways that go beyond physical symptoms. In my research in this article at Medline Plus, these are some of the physical symptoms of asthma: shortness of breath, wheezing, tightness, coughing, especially at night and during exercises, stress, animals, dust. Asthma symptoms are constantly, but they can occur varying from duration or intensity. According to StatPro's publication, asthma symptoms typically occur lasting for hours or days and resolve upon the removal of triggers or the administration of asthma medications. So the emotional toll is important too when it comes to asthma. Imagine living in fear of an attack. It can happen, and imagine this anxiety that you get and the depression that would come from that. Remember, emotions can range from happiness, laughter, to anger, to frustration. The emotional toll as extends beyond daily stress. Like someone who doesn't have asthma, just daily stress or the thought of it. You could be in a good mood and you think that you might have an attack, and this here causes the depression. This article was published PubMed Central. It says severe clinical studies have found that patients with asthma have higher rates of depression, anxiety, symptoms that they can't control because of this. Studies also suggest that asthma is associated with an increased likelihood of suicidal ideation. As asthma attacks can be life-threatening, it can require emergency hospitalization and also financial and emotional stress. So these are things that are outside the physical that adds on to having asthma. Despite its challenges, asthma can be managed effectively with the right approach. Effective asthma management includes medication, lifestyle changes, and prevention strategies. As per Medline Plus article, it mentioned that there are quick relief medications such as inhalers to help open the airways during an attack. Long-term control medications like corticosteroids reduce airway inflammation. So that's a long time one that you could use. According to the American Lung Association, Asthma Tech Plan is one of the most important tools for managing asthma. They mentioned that it's called an asthma action plan. So it helps you know what to do if your asthma symptoms get worse. It includes it includes steps for using medication, avoiding triggers, and what to do during the asthma attack. So having a plan like this makes it easier to stay on top of your asthma and avoid serious attacks, as the article mentioned. Managing asthma is not simple, and it can be frustrating, but avoiding these triggers like using an air purifier, keeping up with doctor appointments, and taking medications can help you stick to this treatment plan. And these steps are very crucial to keep asthma under control and prevent serious attacks. Asthma may not have a cure, but education and proper treatment can help individuals lead full, active lives. I highlighted 3 points that are important. First, the causes and triggers of asthma. Second, the effects of the health and daily life. Lastly, the treatment options and management strategies that can help control it. Asthma is a chronic condition that affects the airways in the lungs, and if it's left untreated, it could lead to other health issues and be fatal. So it's important to continue to raise awareness about asthma, and by doing this, we can help those living with it breathe a little bit easier. Thank you.